Welcome back to Girl Talk. Well, good news for people that dread going to the dentist. We have Amy Sargent with us. Thanks for coming in today, Amy.
Thanks for having me.
Amy's with Excellence for Dentistry, and actually it's Excellence in Dentistry.
Yep.
And we're talking technology today, advances in technology. So what is going on? What's the cool new stuff that makes the dental visit not so terribly scary?
Well, there's definitely some really cool stuff out there. I think one thing that most people may know about, at least people that I know about, is called a CEREC machine that makes crowns chairside. So that's really cool. I'll tell you more about that.
Okay.
And then the other thing is digital x-rays and lasers in dentistry.
I like the digital x-ray sound. I hate getting those things in my mouth that...
You'll still have to get little things in your mouth. Oh, no! But it is quick.
Okay.
But you still have to have the little tabs. But
Oh.
And then we have intraoral cameras which help show us or show patients the inside of their mouth, kind of how we see it.
A close-up.
Yep, very
Extreme
close-up.
close-up.
Yep, which is not always fun for people, but it's helpful.
This is interesting. So the technology keeps advancing, which
Yep.
of course is much better for patients.
Yep, it is.
So there's a machine now that actually makes crowns. So that has to make your life easier, and then the patients as well. How does that work?
So it's called the CEREC machine, which I referred to earlier, and it's some people may have heard of CAD/CAM technology, and that's what it is. It's computer-aided design, computer-aided manufacturing. Wow. So it uses that technology to basically create a crown while a patient is still in the office. Wow. So you may have some of you may have had a crown before where you have to come back in 2 weeks. Well, this is great for a patient. The machine is chairside, and we utilize a special camera to take photos of the prepared tooth.
Wow.
Yeah.
2015.
Right,
Isn't it great? That's wonderful.
It's great, yeah.
Everything's
Same
so
day
instant.
procedure now.
Yep.
Yes,
Right.
absolutely.
So are there differences, or is the crown made of the same material as a traditional crown then, or is that different too?
Good question. So crowns can be made of basically 3 different materials. One would be an all gold material, which is beautiful, nice, long-lasting. And then there's a porcelain fused to metal. And then there's an all porcelain crown. So I would say more commonly these days we're doing all porcelain crowns. People want the aesthetics of all porcelain, and they're a very solid material, so we can use all porcelain in many areas of the mouth. So that's what the CEREC crowns are made of, is all porcelain. So they're very aesthetic, and they're very long lasting as well.
So no matter what face you're making, you can see it's
beautiful,
seamless.
white.
Yeah, that's really good.
Yep.
So it sounds like this technology not only helps the patient, but it probably helps you too.
It does. It
And
does.
What are some of the other advantages of this machine you're talking about?
Well, I think the biggest advantage that I did refer to is the patient having to spend less time in the dental chair. So they don't have to come back in 2 weeks, and they don't have to worry about wearing a temporary crown, which for some people can be a nuisance or it can come off. So it's really nice to be able to cement that crown on the same day.
How convenient.
Yep,
Yeah.
it's very nice. And for us, I guess the same thing. It saves us time. We can get the procedure done at once, cement the crown on. So it's great, and the product is excellent. So
And you look like the hero.
right, it works great. Yes, exactly.
No wonder. Now we're figuring it all out.
Yes.
But you mentioned really, I want to kind of go back to lasers because I'm curious about this, because lasers are being utilized in a lot of different fields now. So lasers in dentistry, kind of tell us a little bit, what do you use them for?
Many different things. One of the, I think, most exciting things is called Periolace.
Okay.
And Periolace is laser-assisted new attachment procedure. So it's used to treat periodontal disease.
Okay.
So I'm going to table that for now because we're going to talk about that at a future meeting.
We'll have you back.
Yeah, we'll talk about that.
Yes,
But that's a
about
very
lasers.
exciting advancement. And then lasers can be used on gum tissue. They can be used for wound healing. They can be used to clean out the sulcus during a periodontal cleaning. So many different things. We actually use lasers to treat cold sores and canker sores.
Wow. It's fascinating how the technology that you offer just totally changes the scope of dental work and just the experience for the patient. I mean, it's
The quality of everything, the care
Yes.
and just the visit and the experience itself.
It is
Real
nice.
quick,
Yep.
could you tell us what the benefits are of using the laser versus traditional methods?
So a laser tends to be a great way to provide a service with very little discomfort.
Okay.
So the typical things that you would think of, I hate to use this word, but like cutting, surgery, that healing time is a little more than
Sure.
when you provide the service with a laser.
Well, we'll have to get you back and
Yep.
talk more about the
Yep.
laser. That sounds very intriguing.
Yep, yep.
Thanks for coming in. Amy,
Thanks for
where
having
can
me.
folks find you?
Excellence in Dentistry in Madison and Cottage Grove.
Very good.
Yep.
We'll be right back with Conan Automotive with our car questions.